And I'm Jean Schumacher. I am the founder of the Weight Loss Advantage, where I help people to lose 50 to 100 pounds without dieting. And you can find my website at www.weightlossadvantage.co. I couldn't get the com, so I had to go with the CO. And my partner here is Dr. Deborah Shapiro. She's a plant-based, board-certified gynecologist. She's done the Main Street Vegan Academy. She's certified as a vegan lifestyle coach and educator, and she's done the Health Coach Institute. She's also done the plant-based certificate through Cornell. I've done that one too. And she has a website called anewviewoffood.com. And tonight, I got to tell you guys, we're in for a little secret. Dr. Shapiro and I are working on a new program called the Pregnancy Advantage. And we are working to get a program together to help women get pregnant ready, to get your bodies ready to get pregnant. Or if you're having problems getting pregnant, then perhaps we can give you a hand with that. So tonight, our topic is going to be menopause. Here's the big question. What is menopause? What governs the age of menopause? And if you can just take us through some of the stages.
Well, menopause is actually defined as a year without a period. It happens actually at about 51, average age 45 to 55, 51.3. It's been remarkably stable over the years. And it happens because we've run out of our really good eggs. So if you could think about when we're developing inside of our mother's uterus, we have a set number of follicles, and these follicles are the cells around an ovum. And when we're born, we have about I think 1 to 2 million, but by the time we reach menarche, we have about 300,000. And we ovulate about 500 in our lifetime. So every time we develop an egg, or every time we have a cycle, we don't just develop one, we actually develop a few, and some just disappear. And we ovulate 1 or 2. When we've run out of these good eggs, I use the analogy of a bowl of popcorn. So especially if you're making your own popcorn, you have the very
oil-free, right?
Yes, of course. But you have the very fluffy, good popcorn kernels at the top that have all popped. And when you get down to the bottom, you notice there's always some kernels that just haven't popped. And that's sort of what remains in your ovaries when you get to be sort of toward the end of your 40s. These follicles these eggs were not going to be able to be fertilized and become babies. And when that happens, your estrogen levels drop because the cells around the egg are called the granulosa cells, and they make estrogen. And they make a certain amount of estrogen as the follicles develop, which triggers a burst of luteinizing hormone, which causes ovulation, and then you get progesterone, and then you get, if you don't have a pregnancy, the estrogen and progesterone levels drop, and you end up getting a period. But when you no longer have those good eggs and the granulosa cells making a regular amount or a normal amount of estrogen, then you're not going to trigger the ovulation. You're going to have anovulatory cycles, and you're going to have irregular bleeding, and eventually have no more periods at all. It's not just, so the definition of menopause is a whole year without a period, but most of us don't just get to that point and just stop. We don't just stop getting our periods. Some people do, but a lot of people go through a period of time called the perimenopause. And the perimenopause is just that, the time around the menopause. And this is when you sort of used up your good eggs, but you're still ovulating, but not having the same amount of estrogen and progesterone every month. And you have irregular bleeding and some symptoms of the menopause, hot flashes and flushes. The symptoms in the perimenopause are not as significant or as severe as the ones that you get after you've actually stopped getting your periods, but they're still uncomfortable.
Okay. Well, I know when I went through menopause, I was plant-based, and I really had hardly any issues going through menopause. I mean, I might have a random hot flash, but it wasn't like, oh my God, I got to rip my clothes off. It was just a mild flushing and quickly went away, and that was it.
Right.
So
It's quite variable, and there are some differences, some racial differences. So African American women seem to have more hot flashes and flushes than, say, Asian women. But they think, and so for a while people were thinking, well, that was because Asian women, especially Japanese women, were eating more soy, and that was keeping them from getting the severe hot flashes. But actually now they think possibly it's just that Japanese women may not be as inclined to complain about hot flashes. It may just be their comfort level with talking about it. So also women who are heavier, because we could talk about what a hot flash and a flush is, but when you are heavier, you have more insulation. The adipose tissue are sort of insulating you and keeping you from being able to dissipate the heat. And so heavier women seem to have more symptoms. So it could be also that when you are plant-based and you're slimmer, that's a little bit easier. But in general, there's also just genetic changes. So they've actually determined that there is a gene, or some genes, but definitely a gene on chromosome 4 that codes for something called tachykinin, and there's also neurokinin and neurokinin B. And if you give neurokinin to somebody, you will elicit a hot flash. So there are genetic differences, and some people have more or less. So if your mother went through menopause very easily, it's possible that you will do it the same. But we know about epigenetics, where we can turn on genes or turn off genes. So maybe I would think also being on a plant-based diet might affect the expression of that neurokinin B or neurokinin B receptor.
Okay. Well, before we get into our next question, which is a good one, please, everybody, if you're listening to this live, please share on your timeline, or if you're not listening to it live, you're listening to it afterwards, please share on your timeline, because you never know who it can help down the road. If somebody's having issues with menopause, something that they hear tonight might help them. So please do share. That's all we ask. So this is a great question. This is from Cheryl O'Farrell, and we had planned to do menopause once upon a time, and we never got to it. But so Cheryl O'Farrell, if you're out there, here's your question. I had a complete hysterectomy in 2004, and I never took hormones. Breast cancer runs on my dad's side. My skin has thinned out so much, I bump my hand or arm, and I get a blood blister immediately. I eat whole food plant-based. Is there anything else I can do to truly thicken my skin? Hopefully you can cover this.
Right. Well, I was thinking about this a lot because my father-in-law also has very fragile skin. And when he gets bumped, he bruises and bleeds tremendously. And I know this is something that a lot of older people have, but I see it more when people are on blood thinners. And I was wondering if...
Well, wait, Cheryl's just popped in. So, Cheryl, are you on blood thinners? So if you can respond, let us know.
But otherwise, we do know that estrogen does affect the skin turgor, the thickness, the elasticity, the wrinkles. If you ever seen somebody who's been on a raw diet, you can tell that these people look extremely young. And that could also be because skin is affected by oxidative stress and inflammation. Especially.
She said no to blood thinners.
Okay, excellent. But still there's this bruising. It's interesting. So I'm not a dermatologist. I'm just a gynecologist. So skin, I know what I've looked up for you. And I would say at this point, since it's been so many, there's no estrogen to put on your skin, like of your face. Nobody would give you hormone replacement therapy 15 years after a hysterectomy. And I imagine when you said a full hysterectomy, you meant that a hysterectomy and oophorectomy, that you had your ovaries removed and you just went through menopause. Is that true? That you went through a menopause 15 years ago and we're not on hormones? So, but air pollution and toxins in the air, and especially, cigarette smoking, and so things that and sunlight, all of this causes oxidative stress. So if you wanted to do everything to reverse changes is always going to be more difficult than to prevent changes. So to try to prevent wrinkling, for example, we know that you should be on a diet that's high in green and yellow and orange vegetables. These seem to be particularly good. Also, green tea has been shown to be very good for preventing and maybe even helping the skin even afterwards. There was a study about that. But again, you can buy, there are all kinds of potions online that people will give you. But I think it's really about preventing the oxidative stress, using a good sunscreen, a safe sunscreen. The Environmental Working Group talks about the sunscreens that are safe and the ones that really aren't, that have chemicals that are not safe. Not smoking, because would be another, not having that would be another oxidative stress that would cause oxidative injury. Keeping up, having good blood flow, staying well hydrated. These are all things that would be very good for your skin. But reversing changes is always harder than just preventing changes in the first place. You would agree with that, right?
I agree. Yeah. Absolutely. And I'm just going to put a plug in for Pure Haven Essentials, because these are products that are 100% non-toxic. So, and they've got some great skin, and, it's not going to stop your skin from thinning, but, what she was talking about in terms of like protecting your skin from sun, or, the oxidative stress when you're dried out, in pieces like that. So I don't know if there's any way that you can completely reverse that. I mean, because I think that has to do with, a lot. And this is one thing that I have found, we tend to compartmentalize the body and look at one piece. And I think we have to step back and look at the whole thing. Let me give you an example. And I know we're digressing, but I do that sometimes.
That's all right.
So when I was perimenopausal, I started getting migraines. Okay. And my regular doctor said, "Oh my God, this is not normal. So I'm going to send you to the neurologist." And I went to the neurologist, and he's like, I've never seen this. And I did every test. I mean, for 6 months, he put me through all of these tests. They all came back negative. Mm-hmm. And he was scaring me so bad. He's like, "Well, the only thing that I can think of is a tumor, and da-da-da." And I'm like, oh my God, to the point where I was like, literally, I had teenage kids, young teenage children. And I thought, oh my God, what happens if I die? What's going to happen to my kids? I mean, literally, he had me, like picking out coffins. I mean, that's how scared I was. Wow. And then I went to my OBGYN, for my annual check under the hood. And she's like, "Has anything changed?" And I said, I started getting big migraines. She's like, "I see it all the time. You're perimenopausal. When you get through menopause, they'll stop." I'm like, "You need to go talk to the neurologist. He had me dead."
Terrible.
And I think, I think looking at the whole body, instead of just focusing on one system, I mean, what is the issue there with the skin? I mean, does it, did your skin change after that you had this? And is it because of the hormones? That's a good question. Is it actually, causing the change in her skin and elasticity and bruising?
Yeah. We should just say, I would like to just say that we're going to be talking about sort of medical things, and we might even be addressing somebody's individual problem, but I'm not their physician. I'm not your physician, Cheryl, so I'm not giving any actual medical advice. So whatever I say, please go to your own physician or physician's assistant or nurse practitioner or midwife and get proper treatment from somebody that you have a relationship with. So I'm only giving just sort of generalized. Yes. So estrogen does play a role, and one place we can really see this is in the vagina. So after menopause, they call it, they used to call it just vaginal atrophy, but that's fallen out of favor. Now we call it genitourinary syndrome of the menopause, genitourinary syndrome, because it's not just vaginal changes, but it's also vulvar changes as well, and even bladder changes, right, in the urinary tract as well. So we see thinning of the skin, we see more fragility, we see loss of subcutaneous fat, we see even sometimes some agglutination where the labia can stick together, we see sort of loss of the contour. there's narrowing of the introitus, the opening to the vagina. There's shortening of the vagina. Certainly there's less transudate, less lubrication. And all of this is due to estrogen, loss of estrogen. And normally when women first go through the menopause, they may not notice this so much, but I found in my practice that after about 5 years of no estrogen, they do start really noticing this dryness. And it could just be a feeling of dryness, or it can be actual pain with intercourse, or you can have a different smell because there's now a change in the pH and a whole change in the microbiome of the vagina, and also more bladder infections as well. So vaginal infections, bladder infections, all because of the loss of estrogen. And that can be fixed. I would not wait 15 years to do it. I think if you're suffering from the genitourinary syndrome of the menopause, you should see your clinician, and you could very easily start on, first, if you wanted just a lubricant for intercourse, if you wanted to have intercourse, or a moisturizer, a genital moisturizer, and there's some that are safe, or you could even just use coconut oil, I believe, or you could go on some vaginal estrogen, and that would also be quite safe. So vaginal estrogen is a low dose estrogen, can be useful to help prevent more changes and even reverse some changes, and it's safe long term.
Well, I'm just picking up on your concept of estrogen and I'm just wondering if there's a relationship too, because like there's some chemicals in your body like parabens that mimic estrogen. And I'm just wondering because they're bioaccumulative. Mm-hmm. So, and I'm just wondering if that also has that impact within. I know it has impact on the reproductive system. So I'm just wondering if, Cheryl, have you checked into your personal care products and looked at, and what you said, the EWG. If you go on EWG.org, there is it's called the Cosmetic Database, and I strongly recommend every woman out there should have the app. You can download it for free. It's called Healthy Living. Please, okay, start looking up your personal care products, because that can have a huge impact on your reproductive system in several different ways.
What's interesting about, for example, phytoestrogens is that, remember that the estrogen in soy, for example, sits in the beta receptor, not the alpha receptor, but the vaginal mucosa and all of that has alpha receptors for estrogen. So that might be also something with the parabens. I don't know what receptors it might or might not sit into, but that's why, putting tofu in your vagina is not going to help. Or even sorry, I had to do that.
Just say that.
Sorry. Forgive me. No, but people talk about using soy in the menopause. And we could talk more about that in the studies, because
putting it into the vagina?
No, nobody talks about that.
Oh, good. Okay.
I made that up. But still, the idea is that soy is not going to help you with vaginal dryness.
Okay.
That part still stands, because soy sits in the beta receptors and the vagina has alpha receptors.
Got it.
Okay.
So please, nobody go start putting tofu up. No. Cheryl said she was in the middle of changing all of her personal care products. Excellent, Cheryl. That is a huge, huge, huge. Seriously, the toxins, I cannot even begin to tell you. I'm big on this. I mean, this is my chemistry background, and the toxins that are coming out of you, baby, you want to be careful with, okay? And if anybody else is listening out there, there is a whole series I did with Dr. Neil Barnard on power foods for the brain, and a lot of the stuff that's in your fat cells that comes out. Wow. And that's some of the things that can be triggering Alzheimer's. So I direct you to Simply Plant-Based under videos on my website, simplyplantbased.net. Go under videos, and there's a whole series I did with Dr. Barnard. Fabulous series, Power Food for the Brain. If you haven't read that book, wow, that's a good one.
Yes.
So, all right.
But I think one other thing though about the skin, because let's just talk about, there's oxidative stress, inflammation, and ischemia. So for the skin, you really want to get more oxygen to the skin. You want to keep it well hydrated. You want to do everything you can to have anti-inflammatory foods and foods that are high in antioxidants. So So all the colors of the rainbow, of course, and spices, and make sure that you're getting enough algae-based, microalgae-based omega-3s, because they will fight off. They're very anti-inflammatory, and will balance any of the pro-inflammatory arachidonic acid that you have been taking in by having some omega-6s. So that's what you may need to do for your skin. And the more raw you can do, even a high raw diet, which is 50 to 74% raw by weight, I think would be an extremely healthy diet to have.
Okay. I'm not a big fan. I mean, 100% raw. I just couldn't
No,
do
not
it.
100. No, 50 to 74%.
No, I'm just saying. I'm just commenting on me. I
think you're
like
absolutely
cooked
right.
food.
I like cooked food too. It's easier on the gut too. I mean, you can't take
Yeah.
someone with Crohn's or colitis and put them on a raw diet. You can't, but you can have juices. And I think that, green juices, you think about, greens and green tea, for example. He was talking about green tea being so good for your skin. Also, really, I don't know if you saw that picture. There was a man who was a truck driver. Did you see that? It was years ago, but there was a picture of his face. He was a truck driver. So this part of his face had been exposed to the sun.
Oh, yes.
It looked 20 years older.
Right.
So you cannot underestimate or overestimate the importance of sunscreen. So I would definitely use sunscreen all the time. Yeah. Okay.
All right, let's moving on.
Yes.
Is there any connection to getting your first period later at age 16 to also reaching menopause later?
No, actually what I had always been taught is that when you get your period earlier, you tend to go later. And when you get your period late, you go earlier. So nope, I don't think so. Not that I'm aware of. Yes. Now, there have been small changes, very small changes in the age of menarche. I know there's some talk about, kids 8 and 9 getting their periods, but overall, in terms of the whole population, it's really still like 12.3. Maybe it's getting a little bit less, but it's still remarkably stable over time. And menopause, absolutely stable, average age 51.
Okay. All right. So what changes will women face as menopause approaches? I mean, and why? We'll get into this next question afterwards, but what are some of the changes?
The changes. Well, let's talk about the good changes, because I really want to focus on this. I think about this time as being really a time of freedom. I was thinking about how my life was bothered by my hormones. I had what? Yeah.
Right?
Yeah. Yeah. I had horrible bleeding. And I was not plant-based, of course. And if someone had just told me to give up dairy, it might have been a lot better. But I was bleeding so heavily. I had to sleep on a towel, and I had horrendous cramps. I was finally told in my internship that I had to go on birth control pills, or I couldn't actually continue in my internship. So I stayed on birth control pills my whole menstrual life.
Wow.
Because I had PMS. I always knew I was gonna cry the day. If I listened to some ad on TV, I'd be crying. And when I was having sex with men, I was always, you worry about pregnancy. And so all of that, you're freed from all of that. You're freed from worry about pregnancy, worry about bleeding, of anemia, and people talk about the FU 50s. I think there's a kind of a maturity that comes with getting a little bit older. And I think you sort of don't sweat the small stuff anymore. I think you know what's important. And so I think that there's a wisdom that comes from your age and accumulated wisdom. And I think that we should really revel in that. We should really rejoice in that and appreciate that in each other. So I think the menopause is a very freeing time. You can be sexual without worrying about pregnancy. You're not going to be bleeding through things. You're not going to have to worry about buying tampons and pads and all of that. So that's the good stuff.
That is, yeah. But going through the menopause, my emotions, oh my God, my poor husband. I'll never forget. I dropped my cell phone in our pond in the backyard. Yeah. And he took me to get another cell phone. And I'm having like this nuclear meltdown in the store. And my husband's like, we have to go home. And I'm like, no, we have to get a phone. Yeah. And I still remember that to this day. And it's like, oh, my poor husband.
I'm sorry. It is true that without estrogen, as the estrogen sort of wanes, you don't feel as stable, and with the lack of estrogen, your sleep is really disturbed. You don't get into that nice REM sleep, and without REM sleep, it's like that's a form of torture, right? Not to let people sleep appropriately. So you're going to be more fragile and more emotional. There's also depression, and estrogen really affects your hormones, the serotonin and norepinephrine and dopamine, the endorphins. And so it's a real thing. And actually the diagnosis of depression is 2.5 times more likely to be diagnosed with depression during the menopause. And also, I just like to say something about that time of life, because it's not just happening to you, but at the same time, your kids, if you have kids, are getting older and they're having difficulties in their teenage years, or they might be leaving home. And also your parents might be having their own health issues and relying on you more. And so there's a lot of pull. There's your husband might be going through, or your spouse might be going through their own issues. So I think it's not just you. There's a lot going on. Just like you said, we should talk about the whole body. I mean, you could think about, the whole community, and certainly your sort of extended family that's affecting you in the menopause as well. So it's not just you. But if you are just single and going through menopause, it's the hot flashes and night sweats can be very upsetting. And you can have aches and joint aches that are actually worse without estrogen. Headaches, like you said. What else? I mean, anything. I've heard people say that their skin is crawling. I mean, anything can happen in the menopause.
I just remember just being emotionally out of control and just melting down at the slightest things. And now I'm not. I mean, now I just have such a very positive attitude. And it's like, I'm so happy. Everything that's all done. And I don't have that monthly issue, done. I don't even think about it anymore. It's like, and the
Right.
hormonal swings, throughout as you went through that monthly cycle. Wow. I mean, PMS, God help my, whoa.
Right.
Yeah.
Right. So that's gone. So that's good.
Yes.
There are only 3 vertebrates that live a significant amount of time after their reproductive years. There's the killer whales, the right whale, I believe, and us. And the killer whales, the mature killer whales, those matriarchs, they're really revered. They're the leaders of their pods because of their accumulated wisdom. So again, I would just think about this time as a time to really sort of do a self-assessment. Like, is this the body that's going to take you through the next 40 to 50 years? Do you know your numbers? Do you know your cholesterol and is your weight right? And are you strong? And are you getting enough exercise? And are you not smoking anymore? So all of that, this is a time to really think about, at least it was for me, and maybe it was because my mom died soon after her menopause, but I think it's a good time to think about whether you're doing everything possible to live the longest, healthiest life possible.
Because I don't think we're living longer. I think we're dying slower.
Yes. We're spending like the last 10 years in somebody else's care, practically.
I know. And I don't want to do that. I mean, and I think this is one of the reasons why that every second, every being of my life is focused on how can I be the best in health that I can, from losing weight to, making sure that I'm not going to have Alzheimer's, to, doing everything that I possibly can so that I can live a long, healthy life. Because I still want to be out kayaking and biking and hiking right up until the day I pass from this planet.
Right. I'd also like to put a little plug in for something even beyond ourselves, and that is the environment. And so if you're worried about being that you can't really make the choice to be plant-based for yourself, then maybe you want to be plant-based for the next generation. Because
we can't sustain.
They say that if we don't change how we eat now, if we all continue to eat as we're eating right now, we'll need another planet Earth by the year 2050, another planet Earth. And I don't have one, so
my pockets are fresh out.
Right. So, but if we all went vegan, then we would have a 70% reduction in greenhouse gas emissions by 2050.
It's ridiculous. I mean, and no one's talking about the animal agricultural industry and the impact that it's having on the environment. It's ridiculous. Anyway, why do some women have an increased libido as they approach menopause, while others experience a decrease? What's going on there?
Well, I have to say, in all my years, so I've been in practice for, let's say, 25 years, and I have only had 2 women post-menopausal who actually said that their libido was increased. Only 2 out of thousands, only 2. So if you are one of those women who feels that you have an increased libido, despite the loss of estrogen, hats off to you. Fabulous. I don't I have not really experienced a lot of that in my practice, or personally, for that matter. So, mm, would you want me to? So I don't know if I could say one thing. There is a shift from estrogen dominant to testosterone, a little bit more androgens, because your ovaries are no longer making the estrogen, but your adrenal glands are still making some testosterone. So, and we give testosterone. We have given. It's fallen a little bit out of favor, but we have given testosterone to women in the past in the form of Test, but also sometimes just testosterone cream to help with libido. And we know that testosterone does help with libido. So, but I would say it's probably more of a social, that we were talking about before, that there's a freedom from worry about getting pregnant, freedom from worry about bleeding and of cycles, and maybe that makes people feel freer to be sexual.
Oop, she got so excited. But I think it's true. I think what you said, once you get in past that point where you're not worrying about being pregnant, because it's a huge thing. Because I know, like my mother, and I think back to her, she was like 45 when she had me. So, and that was like the caboose.
Yeah.
And I'm sure, after she had my sister, which was like, 4.5 years, earlier, that she's like, oh, thank you, I'm done, yay. And then I could just see her at the doctor's office going, I'm what? No. I have a cold or something, right? I'm not pregnant. I mean, I felt for my mother, like now that I'm older and, I'm like, oh my God, at 45, having another baby.
Right.
I mean, and I think about that, and her having such a baby, such a in late in life, and oh my God, what an impact that must have had on her, and
Right. So it's possible that for women who didn't like using birth control, or their spouses didn't like using birth control either, it's possible that reaching menopause, just sort of freed them up. But I again, for the thousands of patients that I've taken care of who've gone through the change, I
don't really see that.
No.
Fired up. Okay. Well, I do know that it is nice not having to worry about pregnancy.
Yeah. Good. But also, if you're suffering from vaginal dryness, then that's really, if you're having pain with intercourse, that's going to be a big turnoff, and you're just not going to want to do it. So I definitely tell people to get some help and don't wait too long. And if you really want to be able to have, people always talk about use it or lose it, and it's really true in terms of the vagina. If you want to be able to put something into the vagina, keep putting something into the vagina, whatever that may be.
Okay. All righty.
Animal or vegetable.
I'm not going down that path. I am not going down that rabbit hole. Okay. What about facial breakouts of acne? I mean, but the rest of your skin is dry. What's going on there?
Well, again, I think this is about androgen dominance, and so the androgens are acting at the hair follicle, and they're affecting the sebaceous glands. And so dermatologists are really, they're cleaning up here. They're working on, I found out, because I'm a patient of dermatologist for adult acne, and it's a huge business. I thought that it would be kids acne, adolescent acne that's keeping the dermatologist going, but no, they told me it's absolutely adult acne. So I saw videos from Gregor that berberine from barberries is supposed to help with acne, and also that possibly sunflower seeds can make it worse. And I know it's possible
maybe the fat and the oil.
It could be, right, because I know McDougall had some twins that were suffering from acne, and he took them off of all nuts and seeds. And I've often felt that if I ate rancid nuts that I would break out. But I have to say, we'd like to think that if you're plant-based, everything is going to be perfect. But it isn't always. And just to be completely honest, I actually do suffer from acne, and I'm on a testosterone blocker called spironolactone that I have to take, and I couldn't find anything else that worked, and so that's what I do. I do take spironolactone, and it has really helped. And I use retin-A also. So, I mean,
But I think there, maybe the hormonal changes is, triggering that. But also too, if you're being plant-based, again, some of the higher fat plant-based things might be contributing to it. So it's something that if you are dealing with that acne, you might just dial down and make it very low fat, whole food, plant-based.
Right.
Because, and also too, I want to just make a comment about a lot of the processed vegan foods. They may be vegan, but here's the problem. They usually, instead of having animal products, what they do is they put in salt, sugar, fat, oils, basically, which is why they taste so good,
Right.
So, if you can focus on just doing it, without, the fat, dial it way down, that might just help with the acne there.
Yes, absolutely. But even so, even if you're as much as you can be whole plant food, actually, it could be genetic because both of my parents had terrible problems with acne as kids. They both needed radiation to their faces, which were done back in the 30s. Yes, they both ended up with thyroid dysfunction and cancers. And so it was not, but that's how they were treating acne back then. So I think part of it could be genetic, and we do our best.
Treating acne with,
yeah.
Oh my
gosh.
That
was the standard with radiation to their face. Yeah.
I can't even imagine. Oh my gosh.
Why my father became a dermatologist, because it was so distressing to have that. So he saw that.
Oh my
was
gosh.
important. Yeah.
Well, I know, like, my physics teacher was one to really, I don't know if you remember back in the day, I'm dating myself, the Buster Brown shoe store. Do you remember that?
Oh yeah. Oh, they radiated your feet.
Yes. Do you remember that?
Yeah. Well, I didn't, but I think my wife did. Yeah.
My mother, my father was a manager at Sears, so everything in our home came from Sears, including, they had shoes and clothing and stuff like that. And so I always wanted to go across the street to the Buster Brown shoe store, where we scientifically measure your foot. And you could stick your foot into that, and every time you press the button to see the foot, and kids were going to be pressing that 10, 12, 15 times, because I would have been in there. You couldn't have gotten me off the machine. I would have been in there looking at my feet, testing my hands, trying to get my whole body in there. I would have. And my physics teacher was one of the ones who was principal in getting that out of the stores, because the radiation, how like targeted, like if you have a tooth x-ray, it's very targeted, very specific, very narrow beam. This was 360 degrees. So everybody in the store was getting it, including the salespeople, which were being bombarded with it. And they were dropping like hotcakes.
Amazing.
So he was one of the advocates of getting that out of the stores. I can't even imagine radiation on the face. I've never heard of that. That would have been a flash again for a while. Oh my gosh.
I think that was standard. Yeah. So some of it might be genetic, but it is definitely an imbalance between there's more testosterone. It's funny because your head hair may thin, but your chin hairs.
What's up with that?
I don't know.
Men, how come all of a sudden men start growing hair in their ears? What is it?
Oh, that's genetic. Do you know there's a gene for that?
We have it in my house. I mean, not me, my husband.
Yeah.
What's up with that? Why do men get this?
No. There's definitely a gene for hairy earlobes. I remember learning about it in genetics, but that's okay.
My uncle, oh my God, you could braid the hair coming out of his ears. I mean, it was like, what's going on with that? What would, in terms of evolution, what would that benefit, please?
I actually don't know.
Better reception to Mars? What are we talking here?
No, keeping the sand out, possibly. I don't know.
There you go. I don't know.
It's why we have eyelashes, right?
My husband says, I've got better sensitivity. I mean, I've got, better wireless. Okay.
All right.
Is there a difference with menopausal symptoms if you're surgically put into menopause versus happening naturally?
Absolutely. Absolutely. Because if you go through it naturally, you're going to have that perimenopausal time with that fluctuating, which, could be a blessing or a curse, right? But you're going to have fluctuating estrogen and progesterone. You're going to have time to get used to the hot flashes and night sweats, I suppose. But if you go through a surgical menopause, then suddenly your ovaries are out, estrogen levels just plummet, and you'll be quite miserable. And I'll tell you that whenever we operated on women and took out their ovaries, if we possibly could, if it wasn't for a cancer where we really couldn't, then we would slap on an estrogen patch in the recovery room and keep them from going through any of those symptoms as they recovered.
Wow.
Because they would be very significant, really pretty awful.
How about for women that never had children? Is menopause going to be different?
Not that I'm aware of. You think if they're not ovulating for 9 months that you'd have more eggs and you'd go through a later menopause, but actually there is no significant change. Even if you've had 12 children, I haven't heard that it makes a difference. It's still between 45 and 55. That's the average age.
Yeah. Well, does menopause cause moodiness or depression? And what I know I'm.
Yes, absolutely.
Yeah, what can you do about it? What can you do?
What can you do about it?
Yeah. Ooh, did I stump her?
No. I was just trying to think. You see, if you are bothered by menopausal symptoms, then maybe you need some treatment, and you can decide what kind of treatment is best. So there's hormone replacement therapy, and that definitely helps with hot flashes and flushes. It helps with vaginal dryness.
But what about cancer with the hormone replacement therapy?
So if you use a small amount for less than 5 years, we know this from the Women's Health Initiative study, which was started in 1993. So when I started in practice, it was 1993, and they were just starting the Women's Health Initiative study, which is a very large randomized controlled study on looking at a couple of arms. They looked at women on estrogen plus progesterone. If they had a uterus, you need the progesterone, so you don't increase the risk of uterine cancer. And they also had an arm of estrogen alone, and they followed them for many years. Now they stopped the estrogen and progesterone arm in 2002 because of an increased risk of heart disease and also of breast cancer. And then they stopped the estrogen alone arm in 2004 because of an increased risk of stroke. And so we could talk about all the different results of this study, and some studies have come out of it and they're probably still looking at them. But the reason they did this study was actually to see whether hormone replacement therapy could be used to treat or to prevent chronic disease, heart disease, dementia, especially. And what we realized was that we should not be using hormone replacement therapy to prevent disease, but you can still use it to treat symptoms. So it's still safe. And the small increased risk of breast cancer in the estrogen and progesterone, remember, these were people taking Prempro. So it's conjugated equine estrogen, which is certainly not vegan. It's Prempro.
That is just gross.
Well, it's mammalian estrogen, so they just figured it was close. So, but it's the horrible horse farms up in Canada, Premarin farms, where they keep the horses. It's very much like a dairy industry, but they're just collecting the urine from these pregnant horses instead of, it's disgusting. But they made a product called Prempro, which is conjugated equine estrogen, and then some medroxyprogesterone acetate, 2.5 milligrams. And that's what they gave that one arm. And then they also gave women Premarin alone. Now, I would not recommend using Premarin, and I would not offer Premarin, but I know doctors who just give that because that's what was tested. And so that's what we know. We know the results of that. And we know that if you're on it for less than 5 years, then you should not be significantly increasing your risk of breast cancer. And so we feel that it's really safe. And also, the other thing about this study was that the age of the women was average, over 65. 67 was the average age. So we would not be giving hormones to women who are 65 years old. You don't want to give hormones to women who are just 50 and kind of miserable for a few years. And that's what I did. I was on birth control pills, as I said, until I was 52. And then I went to a hormone replacement therapy that was like the birth control pills, but a third of the dose. And I did that for 2 years, and then I just stopped. And I had some hot flashes, but it was manageable. And maybe by that time, because I was already really plant-based, maybe it wasn't that bad. So there were other findings from the Women's Health Initiative study. But the major ones was that if you were on hormone replacement therapy, the estrogen plus progesterone for more than 5 years, there was an increased risk of heart disease and breast cancer. It was not seen. They both have even if you're on estrogen alone, they both have an increased risk of stroke and blood clots. There was a decreased risk of colorectal cancer in the estrogen plus progesterone group. There was a decreased risk of fracture as well. So, and lung cancer also. Those are the major findings.
I know, like when I was going through, and sometimes my symptoms would get a little bit more exacerbated. I used in evening primrose, which is, over the counter. Also black cohosh.
Right.
Those were good.
So of all those alternative treatments, so there's hormone replacement therapy. There's also the SSRIs, or the one that's really that is approved by the FDA is Paxil, paroxetine, and you don't even have to wean off of it. You can just take 7.5 milligrams, and you can stop it if you don't like it. You can stop it. You don't have to wean off like on other formulations. And then there are other medications like clonidine, which is a centrally acting blood pressure medication, and also Neurontin is another, or something like gabapentin. So these are other kinds of medications that can be used for hormone as an alternative if you can't take hormone replacement therapy. But the other of the alternative medications, like you just said, evening primrose oil, it hasn't really been shown in randomized controlled studies to make a difference, but individually it doesn't, if it worked, it worked. I have definitely given people black cohosh early on when they're not suffering too much and they just want to try something, but the problem is it can cause liver enzyme problems, or liver disease, so you have to be careful with that. But for women who have had breast cancer and they're on tamoxifen, they can't use an SSRI because it does something, it affects an enzyme that would make the tamoxifen inactive. Because tamoxifen is a pro-chemical, it has to be turned into something else to work. And that enzyme is deactivated by the SSRI. So they would have to use something like clonidine. And I have used clonidine very successfully, and it really does work. And it doesn't really affect the blood pressure much at all. And there's one last treatment that has been shown to help, but I don't think we have it here. It's sort of a nerve block, and it's at the base of the C7L1. So all the other things, the soy, the phytoestrogens, I think there's anecdotal evidence, but in terms of really randomized blinded controlled studies, there really hasn't been a big effect. That being said, we know that people who come from places like Japan, where they grow up eating a lot of soy and have a lot of phytoestrogens, they seem to complain less about hot flashes and sweats. And we don't know whether it's because they just don't complain as much or because of their diets.
Okay. Well, if anybody's just tuning in, please share this on your timeline, or share, to a group or whatever, someplace that you think it might help other women, because, some of the topics we're talking tonight might have an impact for somebody else. So please do share. Another question. Ever since my periods have stopped, my desire for sex has increased. Is this normal?
Has increased? Increased?
Decreased.
Decreased. Yeah, that's more normal. Yes. Okay. It is normal. I'm sorry, it is normal. But this is the thing that's so interesting about when you think about the female sexual response cycle. Nobody really everyone thinks, I don't desire. I have no desire. People come to me, I have no desire. No, let me just put it right out there. Nobody has any desire for sex. You have to get yourself aroused. If you can get yourself aroused, then excited, then there might be some desire. But nobody just innately has a lot of just desire. So it's arousal that comes first. And if you can get yourself aroused.
I don't know. Go talk to those 18, 25-year-old guys.
Right. But still, I'm not talking about them. I'm talking also about when you get to be postmenopausal. But also, if it hurts, you're not going to want to do it.
Yeah.
And we may just have busier lives. It's interesting. What do you think? I mean, that's what I was thinking, that in terms of desire, just so people can back up, you have to just get yourself aroused. If you can get yourself aroused, there may be some desire. You'll still be able to reach orgasm. It might be a little slower, but the orgasm should still feel the same. And we did use some testosterone. We used to use some testosterone to help women reach orgasm faster, but it's sort of fallen out of favor because you can get some androgenic effects. You can get clitoromegaly. You can have your liver function test go up. And so there's also a drug called Ali. Has anyone heard of Ali? That's for a condition called diminished sexual desire.
Okay. I think, part of it is that you've been together, for a long time, if you've been with the same partner, or, and it's kind of like, yeah, been there, done that,
Right.
nothing new. And, if you haven't done anything like, different in the bedroom, over the last 25 years, this is not going to be the time you're going to be starting at, you're not going to be swinging from the chandeliers or, I remember seeing, there was this one show I just absolutely love. Have you ever seen Doc Martin?
Oh, a
It's a
British
British,
show.
it's a British
Yes.
show.
Yes,
And
I
the
love that.
doctor, have you, did you,
Yes.
okay. So there's one episode gets called to this couple's house and he makes a house call and he goes in and the couple is like into S&M, and like they've got some serious like stuff going on in the bedroom and he's just
Yeah.
looking around like, what?
Well, I think it's important to keep things fresh too, right? And make a date, but know that it's not going to seem as, you're not going to have that spontaneous, I think I'm not an expert, right? But you may not have that same kind of spontaneous want to just, grab them and throw them down and right.
I mean, there was a point in my life that, that was
Yeah,
true. I mean, there
yeah,
was a much stronger, I think, drive, especially, in my early 30s. I think there was like my biological clock was going tick,
right,
tock,
right,
tick, tock.
right.
And,
I always think of it more like exercise. So you may not really want to do it when you're just thinking about it, but if you actually get out and do it, it'll feel great and you'll feel great afterwards. And I think
this is true.
that's the way I think about being intimate. And also, it's very important because the
Yeah.
intimacy is the cement that holds you together.
It's true.
And so
It's
you have
true.
to make an effort. If you don't make that effort, things might start to come apart. And
Right.
so it still is that glue. And maybe you won't be in that same oxytocin bubble that you were in your 30s, but it will still feel good. It will still feel
It's
good
true.
and it will bring you closer. And it's important to put that effort into still doing it, even though it might not be the first thing on your mind.
True. Although for my husband, especially because my husband has gone plant-based, and for men out there, if there's any men listening or women who want to avoid that little blue pill, just put your husband on a plant-based diet because that's going to clean up the arteries.
Right.
And if my husband were here right now, he would stick his head in and go, yep, it works. So I think he's trying to make up for the last 25 years that that he wasn't plant-based.
Right. Oh, that's cool. That's good. That same
So,
that same sexual response, the responsiveness of the tissues is the same between the penis and the clitoris, right? So also, if we get our cholesterol down and we're eating foods that open up our blood vessels, those greens that open up your blood vessels, you're going to get more blood flow to your sexual organs as well as a woman, and be able to reach orgasm faster, possibly, and have a larger orgasm.
well, our clutches are different, and we've talked about, my husband and I have talked about that. Definitely, he's got a much shorter gear change than I do. So,
No, women do take longer, and we take longer to lubricate as we're menopausal, and that's why it's important also to use a lubricant. If you feel dry, don't let yourself have intercourse if you're dry,
yeah.
because if
Oh,
it
I know.
hurts,
Well, plus it's a lot of fun to play with. I mean, just saying.
right.
Just
And
going to throw that out there.
the silicone-based lubricants are terrific. They're very slippery. And
Yeah.
Astroglide also is a water-based lubricant that's terrific too.
There we go.
Yes.
All right. What else? What can I do about my aging skin?
Again, I think we talked about it a little bit at the beginning, but green and yellow and orange vegetables are going to be really helpful, and a lot of antioxidants.
Fruit and vegetables, basically.
Yes, foods that are high in phytonutrients. Just try to the algae-based omega-3s. Try to fight all that oxidative stress. Prevent more oxidative stress by using a good sunscreen. Don't smoke. If you really be careful of how you hold your face. Don't scowl a lot, because really you're creating these
Lines.
right, your lines, and you should just smile. I remember asking my dermatologist, how do I keep from getting these wrinkles? She said, just smile. I mean, certainly I can't always smile in my line of work. Sometimes you have to give people some very serious kind of news, but still, if you can, the best thing to do with your face is to be smiling. Not only that, it'll probably help your mood, but
It's true.
Some people, so be careful if you sleep, you should probably sleep on your back. Don't sleep on your side, because I go like this and then, you start to get these lines, right? So don't sleep on your side, sleep on your back. Do people say that a silk, like a satin pillow, might be better for your skin? I don't know. I don't do silk
know.
because I don't do silk. But so smile, don't frown, don't smoke, because maybe you
God,
don't want
smoking. You can tell somebody who smokes.
Yeah.
I mean, you don't need to see them smoke. You just look at their face, and it's like,
Right.
cracked leather. I mean,
Right.
it's not a particularly attractive look. Just saying,
Right. And I think people say stay really well hydrated too, right? So you should stay really well hydrated.
Yeah.
Drink a lot of water. Right.
It's true.
Right.
True.
Do you have any other suggestions for the skin? Because again, I'm not a dermatologist. You could definitely go talk to a dermatologist.
Well, Rachel Huffman-Moore said she's 95 plant-based and her skin is amazing. And I saw such a difference when I started eating more plant-based, and it's true. And I noticed for myself as well. Yeah. I noticed my the elasticity of my skin is much better, even though when I started this, I was in perimenopausal when I started this. My skin tone and is so much better now than it was, when I was half my age. And a couple things that I do use. I mean, I use pretty much only Pure Haven Essentials products. And my routine is I take a hot face cloth at night, as hot as I can stand it, and just put it on my face. And I just my face just, it feels so nice. I put that on until it cools down. And then I use at night, it's called night oil, I think it is. I have to think of that. Anyway, I'm on autopilot. So it's a night oil, and it's
like a vitamin C oil?
No, it's their version of it.
Okay.
Anyway, it's an evening oil that they call it, night oil or whatever. Mm-hmm. And it's got the CQ10 in it. And and then I'll put they have an eye cream in Pure Haven that is to die for. And I just after I put the oil on, I take a dab, 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 and then seal it in. And the next day, I repeat the process if I remember, because some days I'm running out the door and I can't remember, whatever. But I'll do the same thing. I'll repeat with the hot face cloth, and then I'll use during the day. I use hyaluronic acid, and that just literally sucks in the moisture from the environment. I mean, seriously. And then again, I seal it in with that eye cream, and oh my God, my face feels like a baby's bottom. It's that smooth. Very cool. I can't say enough about these products, and the whole thing that I love about them is they're not toxic. So that's my huge thing is, and whatever you want to use, just make sure that you're checking that there are no toxins in them, especially the parabens. And I was thinking back to what you were saying about the tamoxifen, because the tamoxifen is null and void when you've got parabens, which mimic estrogen. And they never tell you this. So
I don't know if that's been studied. I mean, I don't know if it really makes the tamoxifen actually null and void. I don't know, but that's interesting. I mean, certainly the parabens are definitely endocrine disruptors, and they act like estrogens. Yes. I was thinking about the changes in my skin, because before I went plant-based, I was definitely starting to get these lines on the side here. Mm-hmm. And I remember I was so embarrassed about them. It's something else that happens when you first go through menopause, and you just can't stand that you're getting older. So very aware of all of this, and went running to the dermatologist. And I even had, I apologize to the pig, but I even had collagen injected really before I was vegan, which was terrible, and tried different things. But I have to say, and also I remember on my chest starting to get some lines, right, from aging. And now that I'm plant-based, I have not gotten any more of these. This hasn't really gotten worse, and actually my chest looks better. So it's really interesting. I think you can, I mean, it's not a fountain of youth, but we know that the enzyme of aging, right, the mTOR, that we do block that. We can also get our telomeres, that the caps at the end of our chromosomes, to lengthen. So we are actually absolutely changing our lifespan with this, and our cell's life. So it is sort of renewal. It is sort of a renewing kind of a thing. And you don't have to wait until menopause to do this. If you could raise a child, if you could be plant-based while you're pregnant or before you're pregnant, and plant-based and raise your child plant-based, just think of how healthy that child could be and how they would look when they get to be your age. And so
I know
that's something that we're going to be trying to do now with the Pregnancy Advantage, right? Try to get everyone to start out right.
Yes. Clean the body out, get all the toxins out. Let's clean this baby up and get it ready.
Yeah.
And make it a place that I often think about this, and I know this is kind of an offshoot on this. This is hilarious. But when I was I was an elementary principal for quite a while, and we had issues with lice. And so one of the things that I would do for my daughter, oh my God, she had beautiful hair down to her bottom.
Oh,
And
no.
I was frightened, deathly afraid of getting lice, because I just did not want to go through that whole, the toxins and,
Right.
everything that you have to do to clean out the lice from your house. So anyway, so one of the things that we did is I used a detangler that had quite a big scent on it to keep, and basically what the mother lice is looking for, a nice place that she can lay her eggs.
Yeah.
Okay, so if it wasn't a nice place, like it smelled,
Uh-huh.
it kept her away. So, that's kind of like this idea of finding the mother is looking for a good place to have her eggs. So it's the same thing when the egg is coming through. You want to have a good place that you can attach and grow.
Right.
So you're
Right.
looking for that environment. So that's what
Right.
we're gonna try to help people to create that environment,
Right.
so you're pregnant ready.
Right. Because actually now they're actually finding, we know that folic acid, this is off the topic of menopause, but folic acid or folate decreases the risk of a neural tube defect. And now there's so much interest now in these paleo diets, these high protein, high meat diets. They're actually seeing an increase because people are not having enough folate in their diets. So they're actually seeing more birth defects with neural tube defects than ever before because of these low carb diets. So it's really terrible.
It is sad.
So
Well,
okay.
Deborah, we still have like a boatload, so we'll have to come back and do another one.
Okay. All right.
If anybody has
Excellent.
questions, you can message Dr. Shapiro or myself, and we'll get it on the agenda for the next time. And so we'll be posting, again, Simply Plant-Based, Plant-Based Westchester, Plant-Based Cape Cod, and from Simply Plant-Based. Join us. We're going to try and do these on Thursdays. So look forward to seeing you. And as always, Dr. Shapiro, a pleasure.
Yes, really. We're both oops babies, so I'm really happy to meet another oops baby.
Yeah, right?
Right.
All right.
All right. Thank you very much. Thank you, Jean. Thank you. Take care,
Everybody who
everyone.
stayed with us and showed us, please share on your timeline. We'll see you next time.
And enjoy the menopause.
Yeah, right? Bye.
Bye.